My name is Dr. James Cooper. I'm an interventional radiologist, and I'm the Director of Cardiovascular and Interventional Radiology at the Heart and Vascular Center. One of the procedures that we are most involved in disease processes that we treat is called peripheral vascular disease, which is blockage of the arteries outside of the heart that can affect predominantly the legs and also the arms, caused by atherosclerotic plaque. Peripheral vascular disease is a very common disease in the United States. It affects approximately 8.5 million people every year and 20 to 40% of people over the age of 65. It's associated with heart disease as well as hypertension and high cholesterol. The symptoms include pain in your leg when you walk, which is called claudication, but they can be progressive to the point that you have pain all the time or rest pain. Or they also can result in ulcerations of the leg or gangrene of the leg. Untreated peripheral vascular disease can lead to amputation. When we have a patient that we suspect has peripheral vascular disease, we have non-invasive studies that we can do to measure how well the blood is flowing to the legs. If those studies show that there's a problem, we then can do a procedure called angiography, where we put a catheter into the artery, inject X-ray dye, take a picture of the arteries, and if we find a blockage, we can then treat that blockage. There are certain lifestyle modifications that patients can make to lessen their chance or keep disease from progressing. The number one modification that we recommend to patients is to stop smoking. Tobacco use is highly associated with the development of both heart disease and peripheral vascular disease, and if a patient stops smoking, they definitely lower their risk for either. Diet modification is one of the things which is in a patient's control, and a low cholesterol diet is better than a high cholesterol diet. A third modification that we recommend to patients is exercise. The more they exercise, the better their heart health will be, and exercise has been shown to help improve symptoms in patients with mild to moderate peripheral vascular disease, and a patient may be able to exercise and find that their symptoms improve without having an invasive procedure. In this time of COVID and with all the restrictions we all have on us, it's important not to forget your health. More than ever, lifestyle modifications like diet control and exercise are very important, and we all need to find ways to do that despite the limitations of the pandemic.